Each year, more than 23,000 children experience cardiac arrest, and nearly 20% are infants. That's why this American Heart Month, the American Heart Association wants to make sure that every parent and caregiver knows CPR. So let's welcome cardiologist and American Heart Association volunteer, Dr. Johanna Contreras, to the show. Thank you so much for joining us.
Thank you, Jordan. Thank you for having me here.
Of course, this is such an important topic. So why is CPR so important, especially for parents and caregivers to learn?
It's important, as you say, many children, 23,000, will have a cardiac arrest outside the home. And the only thing that can actually double or even triple the chance of survival is if that child will receive CPR right away. That's why we want every single parent or everybody that interacts with children to learn how to do CPR. Is not difficult, and we all can learn it, and we can save people's life.
Yes. So how is CPR different when performing on an infant or a child?
So the difference of really depending on the baby size. If it's a baby, you may only use like your thumbs to be able to do CPR. But if it's a small child, you may only use one hand. If it's a big child, you have to use really two hands. The difference is that you want to give compressions, very compressions, and two breaths. We want to give some breathing to the children. That is the difference between the child and adult, that they need to have some breaths given during the CPR.
Yes, I'm so glad you kind of told us the difference there, because that could be a huge deal, right, when you're dealing with a bigger body versus a much smaller one. And a lot of people are intimidated when it comes to CPR. So can you show us the steps?
Very simple. So number one, you find the victim and you figure out the person is unconscious. You have anything in the mouth, remove it from the mouth. The first thing you have to do is call 911. You then call somebody that is next to you and tell them, please call 911. Or you can call yourself using the phone, and even the operator can help you if you actually don't know what to do at the moment. So then what you want to take is take the victim and place it in something really hard, because you want to be able to be effective CPR. You can do CPR orally. This is a bigger child, and you can place your hands in the middle of the chest, in the middle of the sternum, like on the 2/3 part, and you can actually do compressions. You can do it with one hand if you are a bigger person, a small child. Or you can do it with two hands. You can put two hands together like this, so you can control the pressure. You want to push in the middle of the chest, and you want to do 30 times these compressions. The thickness about 2 inches from the chest. You want to do it, and you want to be consistent with the rhythm. There are many songs that you can find to be able to keep the rhythm. You do 30 of these, and then you look at the child, you put it up, and you actually give the child a couple of breaths. You make sure that the chest will lift as you give the breath. And you continue to do your CPR, 30 compressions, 2 breaths. And obviously you check if the child is coming back alive. That's very important. Or not really, you expect that because you're calling 911, EMS and the paramedics will come as soon as possible.
And let me ask you this, when you were giving the breaths, are we to pinch the nose closed, or don't do that?
No, you don't have to pinch the nose. You can lift it, make sure that you have an airway, and you can give the breath down. You can pinch the nose or not, it doesn't matter. But the important thing is when you give the breath, you want to be effective. You want to see his chest is raising as you give the breath, so you can push the breath. You don't have to like push all your lungs. You just have to be able to give an effective breath and make sure that goes. It's a child, so you don't have to do that. And it's very important that you can check and keep going the compression. But the important thing is that you continue your CPR, your circulation going.
Okay, wonderful. Thank you so much for showing us that. But if we want a little bit more information, where can we go?
You can go to our website, heart.org/nation, and join the National Lifesavers. You can learn CPR. We have videos. You can also sign up for a class. If you want to go and take a class and practice in a Maniquí, there are many classes all over the place that you can go and learn and actually practice, and you can actually save somebody's life. It's very important, because only half of the people that actually have a cardiac arrest will get CPR, and it's very important because we can save people's lives, and you can do it. Anybody can do it.
Well, thank you so much for joining us today, Doctor, to tell us all about it and to give us a resource as well.
No, thank you for having me here.
Of course. And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.